So, hello, doctors, students of homeopathy, and people working in various fields of homeopathy, lovers of homeopathy. A very warm welcome and a very happy new year to all of you. So, let's begin the session with a silent prayer. Thank you, everyone. Today is the 1950th session, 50th day of the uninterrupted daily webinar of International Forum of Promoting Homeopathy. As you all know, IFPH is conducting 3 sessions every day from 7:30 to 10:30 p.m. The recording of the session is also available the very next day, so that who missed the session can watch and get benefited for it. So, our today's guest and distinguished speaker is not a new face of IFPH. He is very well known face of IFPH. He has already given so much webinars on in Hindi and English both sessions. So he is Dr. Assistant Professor Dr. Manish Azad Singh. He has very dynamic personality, and he's very experienced person. He's assistant physician at Divine Homeopathic Clinic Varanasi, and he has conducting this. He has doing this his practice from last 33 years. He is conducting clinic both online and offline, and helped in patient management and OPD cases. He has conducted many webinars, more than 50 webinars in both Hindi and English sessions, and published 15 articles in a well-known magazine in both Hindi and English. He has written a thesis on Kent's repertory and Tinea corporis. Um, his MD thesis, were selected for STSH research on breast cancer. His research on breast cancer and its miasma selected for the CCRH STSH program. He has worked as a data collector for KAB survey also. KAB survey means knowledge, attitude, and behavior service survey regarding lower urinary tract disease in male, and it was a very significant experience. And he took regular lectures of repertory also 3-4 times in a week. So I want to welcome sir, a very warm welcome, sir. And his today's webinar topic is understanding the mind of homeopathy remedies through psychodynamics. Sir, I invite you to share your experience and knowledge with us. Now stage is yours, sir. Yes, sir.
Okay. Hello, good evening, everyone. Let's start the session as it's already 5 minutes late. I can see that. So let's start the session without wasting anyone's time. Hi. So as I was introduced earlier, and many of you must have seen me earlier also, I am Dr. Manish Azad Singh, and today I have came with an interesting topic which we are here to discuss, and that is to understand the mind of homeopathic medicines with the help of psychodynamics. So here the basic concentration of the topic is how psychodynamics can enhance our medicinal knowledge, and as we always discuss that the materia medica is the final judge and repertory is not. Repertory can guide you towards the main medicine when we talk in regards to the patient. Okay, so how materia medica was built and how that psychodynamic affects the patient. Whenever we talk about patients, then we have to understand that there are some problems which come into someone's body due to some reasons. And if we understand that reason, if we understand that psychodynamics, then that can help us understand that how a disease comes in some person's body. For this reason, I have compiled this session with GNM index, with psychological conflicts topic, with GNM index, and with the basic mind level topic also. Okay. So we often get stuck on what the patient has, which is mostly the pathology. But we always miss why the patient is sick. Why is the conflict? that what happened, what changed in the life which caused this disease. So a repertory is not merely a dictionary, it is a biography. Every rubric represents the frozen moment of human suffering. Today, we are trying to trace that psychodynamic journey of a soul from conflict to the lesion. Okay. So today we are trying that how this lesion came into someone's body. What is that reason? So today in this journey, we are trying to find out that why. Okay. So I would request each and everyone that if you will imply this into your clinics, I can assure you that you will have a different kind of knowledge regarding some patients or regarding some diseases. So what is psychodynamics? Psychodynamics is basically the internal war. It is an internal war between the id and the superego. So the id is the instinct desire, what we desire, what we want to have. And the superego is the social constraint. This can be due to family, this can be due to environment, this can be due to anyone anyone in your surrounding. So it can be your family, it can be a society. So that is why superego is a social constraint. So the pathology is the ego's compromise. So whatever pathology develop into your body, that is the compromise of your ego. We all have learned about id, ego, and superego. So it is the instinct or the desire of your body, and the superego is the social constraint, which is not letting you do what are you desiring to. Also, since I have taken the help of GNM, so I have mentioned it here, the German new medicine. Every disease starts with a Dirk-Hammer syndrome, that is Hammer's theory, that unexpected acute shock lived in isolation and creating a three-level response, that is the pathological level, the brain level, and the organ level. Okay, so that this is what we are trying to find out. So what we are trying to do, I'm trying to explain the psychodynamic action through the help of some examples. So our body does not make mistakes. Every pathology which we have serves a biological survival purpose rooted in the conflict resolution. So let's say there is a conflict that a patient cannot digest a situation, an insult from a boss, a betrayal word that stick in the craw. Okay. So today, when we talk about peptic ulcer, then even this the today's science says that stress has a very major factor in the pathology of the development of the peptic ulcer. Obviously, when we are talking about the acidity and the things like acid secretion, hyperacidity, then the stress or the work environment in which you are living, that is always responsible. So when we talk about homeopathy, the psychodynamic perspective, then again, if someone is having a situation where someone is being constantly insulted, then the biological responses would be the stomach endoderm would increase the cell to produce more acid. That can manifest as tumor, that can manifest as gastritis, can be acidity, and the attempt would be to digest that emotional insult. So on the psychodynamic layer, what will happen? The patient will suppress that anger through repression. The rage turns inward and that will manifest somatically. So whenever we talk about acidity, whenever we talk about gastritis and symptoms like nausea and vomiting due to this gastritis or symptoms like headache due to this acidity, then why Nux vomica is the prominent remedy? Because Nux vomica always have suppressed anger. Whenever we talk about, there are many medicines. I'm not saying that only suppressed anger nux vomica is only there, but there are many medicines. But ailments from anger suppressed, there is nux vomica, a prominent remedy which we give blindly in the cases of acidity and the causes the pathology which we develop after acidity or the symptoms which develop after acidity. So when we repertorize that symptom, that if someone is there in your life who is constantly insulting you and you have suppressed that inside your body, then in the repertorization we will have to find that precise feeling, the rubric. That would be either ailments from mortification, ailments from indignation, or anger with silent grief, or things like that. Okay. Ailments from disappointment is also there. Ailments from reproaches is also there. Then delusion, mock being is also there. So there are several kind of feelings. What kind of feeling your patient have, you have to identify that. But why we are studying it here in the topic of psychodynamics? Whenever we are meeting a patient who is having gastritis, whenever we are meeting a patient who is having acidity, indigestion, symptoms like indigestion or acidity or gastritis or constant nausea, vomiting, or specifically things which are associated with his gastric ailments, then we have to ask him that, is there someone in your life who is constantly insulting you? Is there any kind of stress in your life? Because whenever we are talking about any things related to gastric complaints, then there is always a kind of shit conflict, a morsel conflict, a conflict where someone is constantly insulting you, a conflict where someone is constantly derogating you, and you kind of repress or suppress that emotion. I'm not saying daily basis, but it has been happened in some episodes, and you are facing with these kinds of symptoms. So the body speaks what the mind cannot articulate. And every symptom which we talk about is a language waiting to be translated. So this is the take which I think we all should know also. Then there is a second story. Story two is the separation. So when we talk about skin complaints, many of the time the skin complaints has a separation conflict. I'm not saying each and every case has a separation conflict. No, it is not necessary. But if you are dealing with a skin complaint, let's say I have taken an example of a clinical case of mine. A mother brings a 7-year-old son, and the son is having severe eczema in elbow folds. It was in the elbow folds and it was behind the knee. So only in the folds of the zone. It has started right after his father went to work in Dubai. So not right after, but month or 2 months after, the father went to Dubai, and the child started having appearance of these eruptions. And he clings to the mother all the day. He keeps scratching until it bleeds, and it is like he's trying to tear his skin off. It is that kind of scratching and itching. Okay. So if we are thinking these kinds of emotions, then obviously the medicines which will come into mind could be dolichos, could be graphitis, mesarium, or sorenum, or sulfur. But what we try to find out here is firstly the id. What is the body trying to need? What is the desire of the body? The desire of the body is deep desire for physical touch, that is skin to skin contact, which he was having with his father. Okay. And what is the defense mechanism? The defense mechanism is trying to scratch, is trying to make that substitute, that missingness which has just started. It is trying to scratch that missingness. So that aggression has turned towards himself. So the trauma is, what is the trauma here? The loss of father's touch. The object of affection vanishes. So basically, the father used to give that affection, and now since the affection has vanished, the complaint appeared, which is scratching. Okay. So when we are decoding this in GNM, it is the tissue is epidermis, obviously the ectoderm. The conflict is separation conflict. So the active phase is the skin numbs and the ulceration comes out visible. Okay. So when we talk about the healing phase, the healing is the body repairs it with the redness, the hottiness, the itchiness. Okay. So the location significance is inner arms or the outer arms. Whenever when we talk about GNM conflict theory, then it is that if something is happening in the inner arm, it is when we are trying to embrace someone. If it is on the outer arms, you are trying to push someone away. So it is that kind of decoding. When we are trying to rubric, again, when we are trying to make a rubric out of it, a rubric translation, then that would be fear of being alone. It can be forsaken feeling. It can be ailments from ailments from disappointment, or ailments from love disappointed. So it can be that kind of rubrics. Again, it can be clinging also, grasp the nurse, clinging. So if he is always clinging to the mother, then that can be clinging. Then fear of being alone. If it is a destructiveness kind of thing, then destructiveness. If he is striking himself, because in this case it was striking himself. Ailments from love disappointed, I have already told, and then forsaken feeling. So when we are talking about these kinds of rubrics, then the remedy consideration would be pulsatilla, mild and weeping person who always weep and has a forsaken feeling at the main core. Phosphorus can be there because it has forsaken feeling. Magnesium carb has orphan feeling, obviously there. We all know that. Then there can be sepia, indifferent, angry. So these kinds of medicine come here. In this case was of MAC carb. When we talk about emotional joints, sorry, emotional weight, then we talk about joints. Okay. This one will tell you about the joint pain. the devaluation conflict. Okay, the joints carrying that emotional weight. So in this case, a 55-year-old retired athlete presents with severe osteoarthritis. I used to be the pillar of my community. This was the patient's wording. He talked in Hindi, I translated in English. So I used to be the pillar of my community. I ran everything. Now I can't even climb stairs. I feel useless. I'm just a burden on my children, and my knees buckle under me. Okay. So uh, he just showed the contradiction that I used to do all of this, and now I'm unable to do all of this. Okay. So this can be delusion getting poor, this can be delusion getting thin, and again, delusion hindrance, delusion worthless. These all delusions can be there. We have to exactly understand what the patient is trying to say. Here, the superego is demanding high performance, utility, strength required, that I must be the pillar. So he still wants to be the pillar. The reality is he's aging. The retirement will remove his functional role and identity. So obviously, you can't always be the pillar. The things will change and you have to grow up. You have to move on. So the narcissistic injury is the self-worth is tied to function, and without function, the existence feels unjustified. Again, if we are trying to understand this from the GNM theory, the tissue is mesoderm, bones, cartilages, muscles. The conflict is self-devaluation conflict. The active stress is on bones, bone osteolysis or loses cells. And when the healing phase comes, then the periosteum stretches to rebuild, and this is when the pain appears. The swelling represents the repair crew at work. So obviously, whenever we are talking with these kinds of patients who are saying that they were the pillar of the community and they used to run everything and now they can't even climb the stairs, we have to understand the delusion. It can be delusion wealth, that okay, I have this kind of wealth. Their wealth can be of knowledge, their wealth can be of friends, their wealth can be of money, any kind of wealth. But there is a delusion. Then there is a delusion great person, that obviously I am the greater person. I have done this kind of thing. I have this kind of achievement, and now he's suffering from delusion getting thin or delusion getting worthless. And that is why this disproportion between whatever he used to be and whatever he is at present, that is causing the disease. So we have to understand that whenever we are talking about these kinds of rubrics, the remedy would be the remedies who are self-reproaching. That is why Aram has been written first. Then there can be Rustox, there can be Lycopodium, because Lycopodium is a lost king, has lost his authority. There can be Sulfur too, because Sulfur has that delusion wealth. Sulfur has that benevolence. Sulfur has that delusion that I'm a great person. Okay. And even in the rubric delusion thin, he is there, that I used to do this, I was able to do this, and now I can't do that. Okay. So even Sulfur can be there. This case, in my expectation, uh, sorry, in the OPD, when this patient came, he was a lycopodium. So this case was treated by lycopodium. When we are talking about the fourth story, the territory, so the boundary is written in biology. So in this case, the case was of urination complaints. Okay. A 28-year-old newly married woman develops burning urination urgency every time her mother-in-law visits. So every time when the mother-in-law used to visit the home, the female used to develop the UTI symptoms. That was urination, urgency, burning, and these kinds of symptoms. The statement of the female was, I feel like I have no space. She enters my bedroom without knocking. She rearranges my kitchen without asking. I can't even go to the bathroom in peace. I just want my own space. So, in my words, I just want to mark my own boundary. Okay. So, because this case was of personal space. So, what happened here? The invasion is a privacy invasion. Okay. The autonomy is lost. The instinct is animals always mark territory with urine. So that is why usually when a person comes with a urinary complaint, you can ask that, is there a stress? Is there someone whom you do not want in your life? Is there? And is someone crossing boundaries or territories? Okay. The biological drive is since a frequent urination, and that is an attempt. Whenever this comes in a healing phase, then inflammation occurs and the boundary finally set. Okay, so that is why in maximum UTI patients, you will see that that burning is not just in urination, that burning is also present in mind. Okay, where there is a anger issue or a jealousy issue. That is why the medicines are like of apis mellifica, lachesis, and then coming Staphysagra, natrum mute, thuja, pulsatile, and that kind of medicines. So whenever we are talking about GNM framework again, then the tissue is ectoderm, bladder lining. The conflict is territorial marking. The active is ulceration widens bladder to hold more urine for marking. Okay. And the healing is that burning, that frequency when the threat leaves. When we are talking about, again, when we are talking about rubrics, then there is ailments from rudeness, sensitive towards rudeness, sensitive towards reprimands, sensitive to reproaches, anger, contradiction from. So this kind of rubrics comes into the play. Anxiety about others, cares full of. So then the remedies would be of something of who have vexation, who have suppressed anger, or who have suppressed grief due to that particular person who just entered into their life and who caused that disease. There can be medicines like Staphysagra, who have silent anger, who have dignity lost, who have greater number of vexation suppressed. Obviously, whenever we talk about person who always have suppressed anger or anger issues, and whenever we talk about anger suppressed and things like that, specifically of a dignified person or a workaholic person or a person whose discipline is disturbed, then axomica comes into play. Cantharis can also be there. Medicines like pulsatilla is also there. So revising all of that which we just studied. So the first one was acidity. Acidity was I can't digest this insult. Okay. So that insult caused that complaint. The GNM conflict would be indigestible anger. The psychodynamic is what? Repression, is suppression, okay, of that anger, of that rage, of that insult. And the key rubric would always be ailments from anger, ailments from vexation, ailments from mortification, and these kinds of rubrics, okay? When we talk about eczema, then it is I miss that touch, I'm alone. So it is most times a separation conflict. I'm not using the word always because obviously no one can say that this is a universal theory, but most of the times it is available. If we kind of dig, we can find that. Many of the time, patient also do not realize that this can be interlinked. When we talk about psychodynamic core, then there is an abandonment or anxiety regarding to that. Key rubric can be forsaken feeling or can be vice versa of that clinging feeling. Okay. If we are talking about arthritis, so in the cases of arthritis, usually there is a self-devaluation conflict that a person is constantly devaluating himself that he used to do this and he's not able to do this. So it can be I'm useless, I failed, I am unable to do this, or I am unable to do that, specifically due to this disease. So that is a kind of self-devaluation conflict. That is the loss of ego or identity. And the key rubrics would be delusion worthless, feelings worthless, forsaken feeling can also be there. So this kind of rubric would come here in the play. When we are talking about cystitis, so in cystitis, it is a boundary marking. Okay. So this is my house. This is my place. This is my bed. This is my room. And I want to draw a line. Okay. So this is a territorial marking kind of conflict. And the invasion or boundary violation is the psychodynamic core here. The key rubric would be ailments from domination, ailments from vexation, ailments from grief, loss, sudden loss, shock. Okay. So this kind of rubrics can be here. The clinical pearl here is the patient's exact word often contain the rubric. Okay. So we have to listen. Most of the times when the patient comes, he only says that rubric. We most of the time do not understand. I can give you an example. There is a patient of this diabetes with me, and he works in a government company and sorry, government organization, and it is a very well organization. And he always comes with this authoritative feeling that I am someone. Okay. But whenever he talks, he always talks that I feel so light that as if I'm flying. Okay. I feel so light specifically when I'm walking. Okay. So this is what delusion, lightweight, walking when. Okay, or delusion flying in air. So this kind of rubrics are always present there. If we try to listen the patient, we will see that, yeah, these kinds of rubrics are there. These kinds of medicines are there. We have to understand what the patient is trying to say. We have to exactly translate that. We language encoded in that speech, the emotional texture beneath that symptoms narrative. Especially right now, I'm working in a wellness center. So the boss or the sir under whom I'm working, he clearly says that if a patient is repeating certain kind of lines or certain kind of symptoms through and through to in the case taking, then that is the place where the vital force lies. Okay, as if someone is saying that the pain is behind the sternum, the pain is behind the sternum, the pain is behind the sternum 3 or 4 times during your case taking of 35 or 45 minutes, that is where the vital force is lying at that time. You have to understand that what kind of pain is that. Okay, even if you're not understanding the mind, understand that pain. Okay, because that pain is where the vital force is lying at that time. Even if you can't understand the psychodynamic, leave it, but understand that pain, understand that what kind of sensation he is going through, what kind of rubrics that would appear, what kind of modalities of that pain he can say or explain, and what is you perceiving from that. Okay, and try to exactly match the patient languages. Here materia medica comes into play. That is why I'm saying that rubrics are helpful, but materia is the final judge. So always cross refer. If causticum is there and you are trying to prescribe someone with causticum, open materia medica once and see that does materia support, because you are trying to give it out of the blue. See it first, that does materia support that or not. So this is the case of Sarah, 35 years old, a presence with hypothyroidism and obesity. So when she came, she sits on the edge of the chair, speaking softly. Okay. So the patient voice was, "Doctor, I feel stuck." Okay. She never said this in the first interview. This was the third or fourth interview, I can say that. So, "Doctor, I feel stuck. My mother-in-law controls everything: the kitchen, the money, the kids. I want to say something, but I can't. If I speak, there will be fight. And I'm terrified of noises. I'm terrified of fighting. So I just stay quiet. I feel like my hands are tied and I just wait." Okay. So what is this? This is the feeling of getting stuck. This is a feeling that I can't move. This is a feeling that I can't do things which I want to. So it screams fight back. Okay. Obviously, your desire is what? Fight back. But the super ego is saying be a good daughter-in-law because you can't say things. This will cause problems in the house. So the defense mechanism is what? Paralyze, gets stuck, freeze. So she cannot find and cannot flee. So she plays dead. Okay. The GNM framework, when we are talking about this, so GNM says that when there is a thyroid conflict, then it relates to speed or relates to powerlessness. So I'm not fast enough to catch the moment, or I'm tied down and I cannot act. In this case, it was the second one, that I'm tied down, I cannot act. The thyroid is low, hypothyroidism came because the organism has given up on racing. So this is a biological hibernation. Okay. The rubric could be delusion tied down, fear of noise, because obviously she said that I'm afraid of that kind of fighting noises. Fear of violence can also be here. Then will loss. There can be torpor. The rubric is torpor or torpid. Then just waiting or staying quiet. Okay. Whenever we talk about hypothyroidism, a prominent remedy which should come into mind should be calcarea carb, which I later prescribed in this case. I can see that. Yeah. So why not Staphysagrea? Because Staphysagrea experiences indignation. Okay. That how dare she? Sarah doesn't feel indignation. She experiences fear and paralysis. Why not Pulsatilla? Because Pulsatilla is a hypocritic female who wants consolation for himself, who wants all the attention of the whole world for herself. She was not like that. She was in very simply telling that I am fearful, I am paralyzed, I don't want to, because I don't want to react, because it is like I don't want to cause the chaos. Gelsemium can also be here. Okay. This case is practically fine at right now with calcarea carb. That is why I'm saying calcarea carb. But this kind of paralytic feeling is usually of gelsemium. So the true remedy is calcarea carb here. Calcarea is the oyster, soft inside and hard shell outside. The core fear is being consumed or observed. So the psychodynamic need here is protection, of security, of stability. The key rubric would be poverty. So the delusion is of getting poor. Okay, that is why in delusion wealth there is a delusion wealth there is calcarea carb. Okay, so the always the fear of calcarea is delusion of getting poor. The alternative could be gelsemium here. Why? Because whenever we are talking about paralysis from anticipation or trembling weakness or complete loss of will to act, then there is gelsemium. There should always be gelsemium. Okay. The remedy choice pivots on whether the paralysis stems from chronic security deprivation or acute fright-induced immobility. So if this case comes to someone in acute, gelsemium should be the medicine. But since this patient came to me in the chronic security problem, calcarea carb worked well. So when we are trying to convert the sentences which was said by the patient into rubric, it would be like, I feel like everyone is looking at me, judging me, then the projection of low self-worth. This is projecting low self-worth. And the rubric could be delusion, she is being watched. Okay. I have done something wrong. I don't know what. It can be delusion criminal. Delusion committed a crime. Or it could be, what is that? It could be delusion criminal or delusion committed crime. This is some kind of unresolved guilt in the superego. I don't want to meet anyone, just lie in bed. So there is the rubric lies in bed wants to, indifference everything to, quite wants to be. These kinds of rubric are there. We can take them. My husband treats me like a servant with tears in the eyes. What is this? This is delusion being abused. Okay. I want to run away from all of this. This is evasion from reality and it is escape attempts to. So always escape attempts to is not the patient running out of your clinic or a patient running from his home. It can be these things also. Yeah, I want to run away from all this. Sometimes patient says that death can be better than this. I sometimes want to die. The rubric is death desires. It is clearly present there, the death desires. Okay. So we can take rubrics like these. Now I'm trying to explain the washerwoman's remedy, CP officinalis, with the help of psychodynamics. So the core conflict of the CPR is the internal warfare, which we usually talk about. Okay. Firstly, I want to tell that whenever we talk about CPR, then CPR is a remedy or each and every one remedy. It is not always about that image which we have made of it. It is not always about that which we have been taught into the colleges. It can be of very different personalities. Because I clearly remember there came once a CPR came into my clinic for the complaint of hemorrhoids. Okay. And it was so jovial, so laughing, so how can I say that? So enthusiastic, so amusement desire when she meets to you, so cheerful and extravagant that, oh my God, I was like, this can be a belladonna or this can be a legacies for sure. But that case was of CPR. Later on, I realized that I gave that and it was a cured case. But the thing is, ki, at the very first meeting, I could never judge that this case was of CPR because she was so jovial, so cheerful, so full of amusement that I was always like that this case could be of Bella, could be of Lecasis or Phosphorus pulsatilla might be in any chance, but not CPR. Okay. So, but in the other cases, when we see, we always feel pity for CPR. So CPR is something like that. That is why get delusion poor. So coming back to the topic, the CPR patient embodies a fierce internal battle between the id, her desire of independence and freedom, masculine energy, and the superego, what is the society's demand. That she be a nurturing mother, obedient wife, and this is not more ambivalence, it is a psychological warfare. So basically what this is the common picture which we all have made in our mind regarding CPI, and that is why I'm also telling that very same story, that CPI is usually a difference between the id and the superego. What is the id? That I want to be free, I want to have my own ambition, I want to have my own job, I want to do something for my own. And what you are getting in return is that society constraint that no, you can't do this. Whenever we talk about this, I remember the movie Miss. There was this female protagonist who wants to be a dancer and do not want to get married, and many people on Instagram posted that this is the real story of CPR. So yeah, that was some kind of it. What is the defense mechanism? What would be the defense mechanism? The withdrawal of libido. So manifest as profound indifference, indifference towards family, indifference towards familiar demands drain her energy. She se- uh, she severs the emotional supply line, and she doesn't harbor hatred, but she simply has nothing left to give. So she becomes the empty vessel. So she had done too much at a time and not wants to do that again. That is why she has become indifferent. Okay. The id impulse is freedom, independence, that masculine energy, or that self actualization. What is the superego demand? That maternal nurturing, that wifely duty, that self sacrifice, that caretaking. So, while all of that caretaking, while all of that self sacrifice, while all of that self duty and maternal nurturing, she never get the time for herself. So, when the time comes, let's say after 5 years, after 10 years, or 11 years of that dancing, of that 11 years of doing everything for someone else, and cares and worries for the family, and cares and worries of the relatives, and getting no time for your own, the result would be complete energetic depletion, leading to the sensation of dragging down. And that is why there is a dragging down sensation in the uterus when we are talking about prolapse of uterus. The ink metaphor is just as the cuttlefish squirts ink to hide from predators, the sepia patient creates an emotional cloud, gloom, silence, indifference to escape her family's demand. Because she do not wants to fulfill that demand, she's showing that indifference. The GNM perspective of this is, if you are talking about uterus and ovaries, the primary battleground of procreation conflict, because the procreation would always be done by the female genitalia, obviously. So the uterine prolapse represents, I want to expel this burden. That is why there is a prolapse. You are trying to expel the burden. Obviously, uterus is not a burden, but it is trying to expel itself. The venous system is varicose veins embody venous stasis. The biological logic of is, I have a heavy load to drag because of that load on the shoulders of his life, of her life. It is a whole family which you have to take with you. So that kind of load is really heavy and she can't move forward effectively. So the blood pools inside those veins and the patient complains varicose veins. When we talk about rectum, then the constipation reflects the inability to let go because you have been so much abused. It can be physical, it can be sexual, it can be mental, but any kind of abuse or any kind of that too much self neglect that you can't let it go. You can't let it go physically, not metaphorically. Okay. The ball and chain conflict. The sepia patient experiences a profound procreation gender conflict. She feels biologically tied down, unable to move freely due to her reproductive role, that is, of pregnancy, children, husband. Sexual frigidity emerges as a biological refusal to accept the male because her territory is already unsafe, because her home is not her home. Her home is of her husband, of her mother-in-law and father-in-law. So obviously that produces that unsafe feeling, and that is why only her body is her own, and that is why she goes into that loss of libido or sexual fragility kinds of things. Now let's understand this with the mind method, the rubric translation. So doctor, I look at my children, I feel nothing. So the patient is saying that I'm a mother. I look at my children. I feel nothing. I know I should love them, but I just want to be left alone. What is that? This is emotional bankruptcy, that you don't have any emotion left. That is withdrawal to preserve yourself. This is indifference toward loved ones. This is aversion from family members. This is that the people who were one used to be loved, who were one used to be more adored by her, is now indifferent. I just want to close my eyes and not deal with anyone. This is denial of reality. This is shutting out stimulus. This is quite wants to be. This is company aversion to, yet fears being alone. Don't touch me. I have no desire. This is rejection of the invader who brings more burden. That is why touch aversion to is there. That is why coition aversion to is also there. That is why usually dyspareunia can be seen in the cases of Platina and sepia and murex. This is the reason of sepia. Patient enters worn, hair, messy, dragging feet. Okay. This is the loss of self-care due to exhaustion. This is indifference towards personal appearance. And that is why whenever we see sepia, we say that it is a housemaid's medicine. Why housemates? Not because they're already, matlab, we all have to give to the housemates only. It is because the looks, that is indifferent towards their own personal look, that is that delusion poor. That is why there's the talking, the tone of CPI is always that pityfulness, and you will always feel pity for her, that, oh my God, what kind of disaster is going on this lady's life. Okay. And this one we all know. If I dance, do Zumba, I feel alive again. That is the rapid movement and the breaking of that stasis or Venus pooling that reconnects to her id, that freedom, and that gives her the sensation of that freedom, and that is why she feels good. That is why dancing ameliorates or exertion physical ameliorates. Now let's quickly compare this with the lycopodium medicine. So Lycopodium clavatum is what? The vegetable sulfur, okay? The theme is usually the imposter syndrome. So the power versus incompetence. The patient, the person directly wants power. Whenever we are talking about lycopodium, we will see that this person wants power. This person wants more power. It has a greed to become more powerful. And versus impotence is what? It lacks that courage, that reality, that metal which really deserves that power. It lacks that. That is why it is lycopodium. The cowardly lion roars at home, submissive at work. This is a very clear and a good definition for lycopodium. This is a cowardly lion. He roars at home and he's submissive at work. That is why we go to that rubric, that uh, submissive to superior and loyal for the inferior. So that kind of rubric. The core paradox is hard on the outside and soft rotten on the inside. Why? Because hard on the outside is whenever a inferior comes, if he is the boss of the office and the people working under him, then he would be like, you do this, and he would be so bossy and dictatorial and all of that. Okay, and then when he comes out of the office or he meets the chancellor or the CEO of the office, then the person would be like, yes sir, yes sir, yes sir, yes sir, this will be done. Okay, yes sir. And that is why he is that hypocritic. That is why the rubric's hypocrisy. That is why smiling when talking to involuntarily. Why smiling? He does not always smile to the inferiors also. He smiles only to those people who can shout on him or who can suppress him. That is why that smiling involuntarily when talking to. That is why that yielding disposition. That is why that submissive yielding disposition. Okay. So that is why spineless. So it is due to all of that. Psychodynamics and biological frameworks, if we talk about this, a massive gap exists between the ego ideal. Okay. So I must be powerful. I must be intellectual. I must be the most dominant person alive on the earth. And what would be the real self? I feel that I'm small. I feel that I'm weak. I feel that I'm incapable. Because lycopodium always has a self-worth issue, always have a self-identity crisis. And that is why he always goes into the self-devaluation conflict. You see, that is why whenever we talk about pains, rheumatoid arthritis, osteoarthritis, joint pains, then always lycopodium is also there because it is always there in the self-devaluation conflict. The defense mechanism is feels small, act long, feels stupid, acts intellectual, terrified of authority, but becomes tyrant to subordinates. Okay, that is why the rubric is dictatorial. The GNM perspective is what? Organs usually affected are liver, gallbladder, stomach, or intestine. Why? Because the anger is territorial. Someone is challenging my authority. I won't get my share or promotion. So starvation conflict or indigestible morsel. Why? Because you have this kind of ego. And if someone says anything to you, you would be feeling that, oh my God, how can he say this to me? But I can't answer because he's my boss. And then you would be going on uh, trying to hold your dignity and repressing that anger. And that is why lycopodium comes into play. Right-sided, why? Because in right-handed individual, right-sided symptoms related to partners, fathers, colleagues, the competitive male sphere, where lycopodium tissue manifests. That is why lycopodium usually is right-handed, and the most of the complaint which lycopodium suffers is from partners or fathers or from colleagues. 85% of the cases is of gas and bloating. Obviously, we know that gas and bloating, lycopodium, carbovec, china, naxomica, these kinds of medicines come. Why gas and bloating? Because there is an inflated ego. There is an inflated ego that wants that is seeking that physical appreciation. That you should give me some appreciation. Okay. 70% is of anticipatory anxiety, that performance fears before public appearance. 60% is of erectile dysfunction, the body's truth, contradicting that mental clauses which you have given yourself. The clinical translation and narratives. So dominating the weaker one to feel strong. Okay. The rubric would be dictatorial or domineering. My wife knows nothing. I have to manage everything. Sit down. Let me speak to wife. So these kinds of patients come into your clinic and they speak like this to their wife. You can see that and you understand that he is a very dictatorial person at his home, and he is talking you with using the words like sir, she do not understands anything, she don't know anything. Hey, you sit down, talk too nicely to sir, tell something to sir. So if the female is pulsatilla, she would just answer by nodding. And if a pulsatilla got married to lycopodium, oh my god, her whole life is doomed. Why? Because she can just nod by answering and he would be whole dictatorial towards her. So dominating the weaker one to feel strong. Uh, let's say the second one. But doctor, the voice softens. My boss is very strict. I cannot say anything to him. So what happens? Now the very same person submitted to the stronger power. This is cowardice. This is timidity. And this can be timidity appearing in public. I have a presentation tomorrow. My throat is dry. My stomach is churning. What if I fall? This is anticipatory anxiety. Obviously, we have read this is in urgentum nitricum, athusocyanum, and gelsimum like medicines. This is anticipatory anxiety about performance and image. This is ailments from anticipation and confidence, want of self. When we talk about inflating ego to hide insecurity, this is like I'm not just clerk, I'm the senior manager of operations. So that is boasting, and the rubric would be haughty or boaster. I think for these kinds of person, only these kinds of references like front office manager has been used for receptionist. So I think that has been started by some persons like Lycopodium only, because they want to boast themselves that I am not receptionist, I am front office manager, because both are usually the same things. Flattery to authority figures to ensure safety. So the patient thinks profusely, thank you so much, sir. You are the best, sir. So what is this? This is flattery. The rubric would be flattering, desire to flattered or flattered desire to these kinds of rubric. These are deceptive rubrics basically. So meet Mr. Lycopodium. He enters your clinic, shakes your hand firmly, maybe a bit too firmly. He would use big medical words to show the understandings that he understands you. Okay, he tells you that he handles millions of dollars of work, but then he whispers into your ear that doctor, my gas is killing me, I have erectile dysfunction. So what you can see the tragedy. Okay, the man who wants to be the king is important. The gas is the inflated ego. The impotency is the inner truth that he is hard on the outside but soft and rotten on the inside. Okay. And when we talk about CPI, on the other hand, for this, imagine a woman who was once a career driven independent dancer and now she has 3 children under 5. She is exhausted. Her husband wants intimacy. The children want food and she feels like a slave. Her body says stop. Her uterus sags, prolapse. Her legs swell, that is varicose veins. She sits in a clinic and says, doctor, take this burden away. I just want to run away. So that is the CPI, and that is stasis, which we are discussing. The last slide for the day, we are comparing CPI with lycopodium. So when we are talking about CPI, the story which I told, in that perspective, CPI is the weary mother. The core feeling would be I'm drained or dragged down. So the GNM conflict would be a procreation conflict or venous stasis. The key difference would be indifference or withdrawal. The reaction to stress would be leave me alone. So that is why isolation. The relationship would be victim of family burden. Okay. On the other hand, Lycopodium is a very different person. He is the insecure boss. So the core feeling is I am small and I must prove that I am big. So the GNM conflict would be territorial anger conflict or rank conflict. The key defense is haughtiness, compensation. The reaction to stress is do as I say. That is why that haughty, contempt to others, dictatorial. The relationship would be tyrant at home and coward at work. This was all for the day. My lecture over here. Thank you very much.
Thank you very much, sir. It was really a very wonderful wonderful session and very much informative for us. Thank you so much. We have time left. If anyone wants to ask anything, please raise your hand or you can type your question in chat.
Yes, thank you, Dr. Manish Azad and Dr. Sruthi Seriga. This kind of presentation and this type of thinking is more needed in homeopathy because the number of diseases are increasing and the complexity is increasing. The advanced technologies discovering new findings. So what is more important is to stick on the basics and to select the constitutional medicine. By following the lectures on material medical, you will get an idea regarding the medicine. This is the Ken's material classical on. Without class material is also formed that way. So definitely nice,
Right.
nice presentation. And but what is the application is very difficult as far as home is concerned, because you should have the ability to this evaluate, then to discriminate. The most exact term is to discriminate between two conditions. So that's the another thing is that always the material medica or the homeopathic material medica classes should be on the basis of the homeopathic philosophy. But what is unfortunately happening is that they are not at all interested in following the Hahnemannian instructions. They think they have some separate entity from homeopathy, and that somebody is teaching the separately, somebody is teaching the material medica, but don't have a philosophical background. It's the greatest tragedy homeopathy is now witnessing. So that should be
Right.
corrected, should be mended or ended as according to Dr. Dunham. Anyway, your attempt is good, and
Thank
you
you,
can
sir.
continue your endeavors. Thank you.
Thank you, sir. Thank you.
It's a really a very good session. You really, what I have, oh, what will be the medicine? We need to study the case in details and what the patient is telling, and converting the feeling of the patient into symptom, and from the symptom we can go to the rubric, and after getting the rubric, then you will have to analysis whether it is a typical delusion or an illusion, or what actually it is. And if you are really if you are able to understand uh, what really is, then you can choose the right rubric, and then go to the uh, best simulum. And once you get the best simulum, you will have to make sure that it is the right medicine that I am going to present. For that, we need to read the materia medica and confirm that the medicine is what medicine you have choose is exactly the medicine the patient required. So if you administer the same medicine to the patient, the result will be fantastic.
Right, sir. So true.
So this kind of yes, this kind of presentation is the need of the hour, and everyone should go in that way.
Network problems, Dr. Tanesh. Yes. I think Dr. Sudhi, you can.
Some network problem is there. Yes.
Yes.
Yes,
I
sir.
think
It was really, yes, sir. How you distinguish cases and how you when anyone come and in first instance you thought that it's belladonna. It happens to all of us. It's really very common things, and how to analyze the case and how to select the case on the basis of what they are saying and what they are experiencing and how to interpret these things are very really very wonderful, and each day whenever I join this or other participants are join and listen to these type of lectures. It's motivate us also to dig into the case and search for the simillimum and how experience and convert those patients' word. So it was really a very wonderful session, sir. Thank you a lot. Thanks a lot for taking time
Thank
and
you. Thank you.
sharing your experience and all this your expertise with us. So hoping more wonderful sessions like this from you, sir.
Thank
So
you. Thank you very much.
thanks a lot, sir, for taking time and for coming here. And you are not a new face here. You are already giving so much lectures, sir. So thank you a lot. Thanks
Thank you.
for being a part of this IFPH family. So I also like to thanks all the participants also and the technical team also. So thanks everyone. So now our English session is over. And sir, Dhanesh sir, if you have any words for tomorrow's session, sir, please share with us.
Some network problems, Dr. Dhanesh, I think.
Dr. Dhanesh.
Tomorrow we will have a session from Dr. Patrick Bhattacharya, and we can expect a big session tomorrow also.
Okay.
Okay, sir.
Yeah.
So, okay, sir. So now I am handing over this session to our Malayalam session. Thanks everyone and have a good night.
എല്ലാവർക്കും നമസ്കാരം. IFPHന്റെ 1950 ദിവസത്തെ മലയാളം പരിപാടിയിലേക്ക് സ്വാഗതം. ആദ്യമായി ഒരു നിമിഷത്തെ മൗന പ്രാർത്ഥന.